The next thing that I want to talk about is the Biogenetics Regenerative Support Kit. These are for you doctors that are offering regenerative therapies in your clinic, whether it be knees, hips, shoulders. I even saw facial rejuvenation the other day, which was kind of cool. But these kits are designed with your practice in mind. The Regenerative Support Kit, basically the idea behind it is that we want to be able to create an environment for your therapy to rest on. There are two types of inflammatory reactions in every single patient, and only one of them is going to be beneficial for your regenerative therapy procedures. Now, we want your stem cells that you're putting into the patient's body, we want those to be able to take root appropriately. And if we have too much inflammation, it doesn't work. And if we have too little inflammation, it doesn't work well either. And so we want to be able to create an environment for that inflammatory balance to show up. And I'll have more on that here in a couple of moments. Number two, we want to enhance the predictability of a clinical outcome. You want to be able to smile at your patient and shake their hand knowing that they're going to come out the other side of this procedure better off. Number three, we want to provide patients a level of support that's above and beyond anything that they're going to find at any other clinic. So it's super important to have points of contact with your office, and adding nutrition in with your physical medicine patients is another way that they are just going to be served above and beyond anything that anybody else in your city is going to be doing. So pretty cool. Therapeutic maintenance is the fourth thing. The ongoing support that your patients get from a joint perspective when they are giving their body the nutrients that they need to promote healthy cartilage, number one, but then number two, healthy synovial fluid, it's phenomenal. So, all right. Anyway, that's what we're looking at here. The precursor to joint damage that most people are missing right now in clinical practice is scurvy. Scurvy is making a comeback in 2018, and it's kind of funny to say that because we all think it's a pirate disease, but we're not seeing the manifestations of like teeth falling out and bleeding gums and facial issues like with the skin. We're not seeing that side of scurvy. We're seeing the other side of scurvy, which is being manifested as joint pain and joint destruction and joints that are basically dehydrating, for lack of a better term. So it's very important to make sure that scurvy is addressed in your clinical therapy, especially if you want your patients to be well in the long run and walking billboards for your services. So one of the ways that we do that, obviously, is vitamin C. Medical literature is very clear that vitamin C is going to basically promote regeneration of articular cartilage. Very cool how it does it, supporting hyaluronic acid production, etc. But one of the things that you're going to find is that this medical literature is kind of sparse when we talk about actual inpatient trials. Now, we have a ton of literature that deal with petri dishes and in vitro studies, and one of the things that we want to do is we want to be able to figure out, well, why do we only have petri dish studies instead of this stuff that is taking place with our patient base. One of the issues that you're going to find is that the absorption rate in a patient population that actually needs the vitamin C is very low. Less than 50% absorption rate when we're talking about tablets and powders for vitamin C. Those are what we would call ester Cs. And so with those ester Cs, the patients can drink $10 worth of powder in a week, but they're only going to get $5 worth of absorption. Not only that, if the vitamin C is not protected once it's inside the bloodstream, it gets removed by the kidneys at a very fast rate. What I'm saying is that the vitamin C has to be in something called a lipid model. The absorption rates are much better in a lipid model, up above 75%, and the absorption rates also lead to better free radical scavenging. That's vacuuming up that metabolic dust once again, right? That's what leads to the tissue breakdown in the first place. So how do we do this in a lipid model? Obviously with liposomes, and the liposomes are made out of a lipid bilayer so that we can, one, get into the bloodstream, and then when we're in the bloodstream, we can be protected from those kidneys, and we can actually get this vitamin C into the target tissue appropriately. The lipid model absorption allows your patient to decrease the inflammatory arthritic situation that's present in many, many of your regenerative patients. Number two, it helps you prevent osteoarthritis. So from what I understand in the medical literature, the biggest area of concern for regenerative medicine right now is osteoarthritis, and the patients that have what we would consider to be autoimmune arthritis conditions. That's a big deal. More on that here in a moment. We can improve collagen formation, obviously, with the vitamin C. We can vacuum up that metabolic dust, once again, that reactive oxygen species that's causing all of the tissue damage in the first place, and we can promote ideal levels of inflammation. We do that, again, through these liposomes. One of the other pieces of the puzzle here for a regenerative therapy patient is not just vitamin C, but something called phosphatidylcholine. Phosphatidylcholine is the main fat component of your synovial fluid. It's what gives the synovial fluid its slipperiness. Its zero friction environment is what we're aiming for, right? So the phosphatidylcholine is very, very effective by itself in pretreatment for people that have rheumatoid arthritis. So that would be an inflammatory-based arthritis, an autoimmune-based arthritis. And then secondly, if we can provide phosphatidylcholine in high enough doses that it gives your patient the ability to replenish their synovial fluid, we're ahead of the game when it comes to regenerative therapy and making sure that those cells that get injected are able to take root and promote proper proliferation. Now, phosphatidylcholine is cell wall. All right, so this lipid layer here, this is phosphatidylcholine. When you don't take phosphatidylcholine in a supplemental form, what happens is that you rely on cell death, apoptosis, cell death, in order to donate its cell wall for your body to use, right? That's one of the reasons why as people age and they start to degenerate and their knees start to dry up, or we get these arthritic changes in the cartilage itself, the patient doesn't readily repair it because their body doesn't want to donate further cell damage, right, to create this phosphatidylcholine. So what we want to do is we want to supplement with it, and we do that in a liquid format, And what's cool is that both the vitamin C, the glutathione that you looked at earlier in the pain support kit, and the phosphatidylcholine are made up of these small unilamellar vesicles. That's what these images are here. So this is the liposome, okay? And what we have is a proprietary technology that allows us to have very small vesicles rather than large vesicles or these multi-layered vesicles. What's interesting is that, just to give you a perspective of size here, this would be like a Skittle, okay, the size of a Skittle. The large unilamellar vesicle would be the size of an exercise ball, and then the multi-layered one would be the size of a Buick. So we have a Skittle, an exercise ball, and a Buick. What you're going to find in the marketplace today are a ton of Buicks. These vesicles are so large that they are unstable. It's kind of like putting too much water in a water balloon. If you move it, it's going to pop. When this pops, what that means is that you now have to absorb it through digestion, where all of the enzymes are in your belly. When you do that, you destroy the antioxidants that are on the inside. So that's not helpful in the first place. Number two, when we look at a small unilamellar vesicle here, so a small single layer vesicle, we want to make sure that it's under 100 nanometers like we're talking about here. The glutathione is under 80, and the phosphatidylcholine that we just looked at is under 30, which is phenomenal. The other one that we're talking about is the vitamin C, which again is under 100. And looking at these, you can tell that they are small because you can see through the liquid itself. If you can't see through it, it's not small enough to get absorbed. It's not small enough to be protected by the vesicle itself, and it's not small enough to get to the target tissue. So just something to remember there. We have a Skittle, an exercise ball, and a Buick. All right, now, when we talk about phosphatidylcholine, we want to make sure that we understand that that phosphatidylcholine has to get into the cell. It has to get into the joint membrane itself, which is very helpful that this is made out of cell wall all by itself. Sliding friction analysis shows that phosphatidylcholine is a very wonderful boundary lubricant for articular cartilage. it helps recreate that zero stress environment once again, making sure that it is as slippery as it can be. All right, now let's talk about my favorite thing here with all of this stuff, and that's the inflammatory balance. We have, in this regenerative therapy world, everybody knows that you need an inflammatory reaction for the cells to take root. We also know that your patients can't be on anti-inflammatory medications, even over-the-counter stuff, leading up to the injection or to the therapeutic intervention. What we want to do is we want to make sure that we understand the difference between the inflammatory issues that we're talking about. Number one, you have a local inflammatory reaction, which is what we want, right? That local inflammatory reaction is caused by the stem cell itself, right? It gets into the joint space and it will create that inflammatory reaction on its own. It does a very good job of that. Now, especially the ones that come out of the umbilical cord. Now, when we talk about systemic inflammation, that's what we don't want. We don't want systemic inflammation present and then the local inflammation on top of it, because it creates a fire that burns so hot that those stem cells can't do their job, right? We want to downregulate or decrease the systemic inflammatory issue before your patients go in and have the local inflammatory procedure. This is super important. This is how you increase the percentages of favorable outcomes, especially for those patients that have inflammatory conditions to begin with. Osteoarthritis, number one. Number two, the autoimmune patients. And so we want to be able to downregulate the inflammatory issue that's systemic, and we do that by utilizing phosphatidylcholine. And how it does that is it creates better bile flow so that your patients can decrease systemic inflammation, creating an environment for your stem cells to do their job effectively, right? That's super cool. I get excited about it. It's functional medicine, which is what my background is in. But the point is that inflammatory balance is key. Yes, you want inflammation, but let's not kid ourselves. There's more than one type. All right, the Biogenetics Regenerative Support Kit comes with 2 containers of phosphatidylcholine, which is the brown in the back, and 1 container of the BioGmax C, and it gives our patients the ability to promote better function in the long run. So use it as pre-therapy leading up to your intervention, and then post-therapeutic intervention they can be on as long as you would like. So very cool.